do you know what all the basic terms that your insurance users mean and how they affect you financially? Welcome. I am the Medical Bill Whisperer, offering answers, insights, and solutions to inform and empower patients like you. This is part 2. Let's go today over the definitions L through Z and what their consequences are to you. But first, do check out my more in-depth videos on many of the items listed here. Long-term care is the medical and non-medical care provided to those unable to perform basic activities of daily life, such as dressing or bathing or feeding themselves. Usually it is not a payable benefit by insurances. The marketplace is the enrollment service for medical insurance created by the Affordable Care Act in 2010, also called Obamacare. A lot of states will run their own exchanges, and for those who don't, the federal government has healthcare.gov to help you out. Medicaid is a program that provides free or low-cost health insurance to some low-income needy people. Those benefits as well as program names vary among states. A medical group is an organization of medical professionals usually located in the same facility who can provide a range of healthcare services. For HMO plans, it is the entity where you are assigned to seek care from. Medically necessary are the medical services or supplies used to diagnose or treat an illness, condition, disease. It means that the services must meet accepted standard of care or must be FDA approved or must meet the insurance medical criteria, usually that the service, procedure, drug is deemed safe, effective, and beneficial. Medicare is the federal health insurance program for seniors over 65 or younger people with disability or end-stage renal disease. Original Medicare is divided in Part A, inpatient or hospital care, Part B, physician and outpatient services, and Part D, pharmacy. All of those benefits are administered by the Federal Medicare Administration. Medicare Part C is the Medicare Advantage option, where all parts are actually under one plan, which is administered by a commercial insurer. A member is someone who is eligible under a plan and therefore entitled to receive benefits under the terms of its policy. The network is the list of facilities, providers, suppliers that your health insurance company has contracted with to provide services at a reduced cost. In-network means the provider and service they render to you will be covered at the highest rate and therefore lowest cost to you. Out-of-network means the provider and services they rendered are not at the highest rate. On the contrary, if covered at all, it will show that the highest cost is yours. Not covered usually means the portion of a provider's bill that is not covered or payable under your plan, usually for out-of-network services. If an exclusion is listed in your policy because it is not medically necessary or deemed experimental, those costs would not be payable and therefore not covered. Observation is a length of time in a facility or hospital where you may be staying without being technically admitted, while your doctor decides whether to discharge you or admit you. The services rendered during that time are considered outpatient, even if over 24 hours. And if you have Medicare, those services will fall under Part B, not Part A. Open enrollment is a yearly period during which you may enroll in a new plan or change your current policy for a different one. Out-of-pocket are the costs that include deductible co-insurance and co-payments, as well as the full price of services that are not covered or payable under your plan. There is usually no limit on the total out-of-pocket, as not covered costs do not get credited towards that share of cost. The limit listed on your policy would only be for the accepted deductible co-insurance and co-payments amounts. Outpatient is a stay or a visit to a facility such as a hospital which lasts less than 24 hours or which do not result in you being admitted. Observation would fall under outpatient. Your plan or policy is the agreement between you and an insurance company, where medical services are covered and paid by your insurance in exchange for you paying premiums. The policy, the list of what's covered, the obligations on both sides, and potential exclusions differ greatly between plans. And the type of plan you have, PPO, HMO, Medicare, etc., will determine how benefits are applied, how care is administered to you, and what your ultimate cost will be. A pre-authorization is often called prior approval, referral, pre-certification. It's all the same. It is the decision issued by your insurance that an upcoming service, treatment, prescription, procedure has been ruled medically necessary and usually guaranteeing payment. Inpatient or expensive treatments or procedures usually require one, but emergency services do not. Pre-existing is a medical condition that started or was diagnosed before you became eligible with your insurance plan. But since 2010, this can no longer be a valid reason for an insurance to terminate your coverage, deny payment of a claim, increase your premiums, or prevent your original enrollment. Yes, there are a couple of exceptions, such as short-term travel policies or emergency insurance. Preferred means in-network. Again, the provider of service has a special contract with your insurance to provide services at a lower cost in exchange for certain benefits. Non-preferred means out of network. The provider can usually bill you for the full amount, while your insurance pays little, if anything at all, because there is no contract with that provider. A premium is the monthly cost of insurance coverage which you, your employer, or both of you pay to be entitled to a policy and therefore coverage under its terms. Preventive care is the routine health care to prevent illnesses, diseases, or other health problems. It includes, but is not limited to, screenings such as colonoscopies, mammograms, mental health issues, blood pressure checks, but also yearly checkups and well-care visits for your children, patient counseling for tobacco or alcohol cessation or nutrition needs, vaccinations, etc. Under Obamacare, the ACA, these services are free to patients when they visit an in-network provider. Your primary care physician, or PCP, is the equivalent of a good old family doctor. Your first contact for providing basic medical services, treating most problems, coordinating care with other physicians, referring you to specialists as needed, and often keeping all medical records to facilitate access and minimize duplication of services or errors. Do note, HMO members must use their PCP first, as that PCP will issue referrals to specialists or to care they cannot provide. And speaking of provider, it is a licensed, specially trained professional or organization that renders medical services. A licensed facility where medical services are rendered is also considered a provider. Qualifying life events are those that makes you suddenly eligible to obtain insurance coverage when not within an open enrollment period. They include loss of coverage because you lost your job, turned 26, or lost your student insurance, or just because you quit your job. A household change such as divorce, marriage, a new baby, a death of a subscriber. A change of residence is a qualifying life event if you relocate or graduate from school. Other circumstances such as losing Medicaid coverage or becoming eligible for Medicare also apply. The share of cost is the sum of all what you must pay yearly before your insurance pays 100% of allowances. It usually means the deductible plus co-insurance total plus visit co-pays. A specialist is a medical provider whose practice and expertise are limited to a certain body system, disease, or branch of medicine. Some examples: internists, oncologists, pediatricians, emergency room physicians, surgeons. Because of a higher level of expertise than a PCP, they have higher visit or office copays, bill higher amounts, and for HMO members, a special referral will be needed, issued by your PCP. The subscriber is the person who is the policy holder or main person named on the policy. Others on that policy would be dependents, such as a spouse or children. The infamous UNC, usual and customary, it's also called UCR, usual, customary, and reasonable. It's an amount your insurance has deemed to be the fair price of medical services or items. In-network UCRs are higher. It is the main incentives for you to receive services by a provider which will extend a discount and accept a lower fee as payment in full. UCRs for out-of-network providers are usually much lower and therefore determine a much higher liability for you. The UCR or UNC is often called allowance on explanation of benefits and are the basis for calculations of what your insurance will pay and how much you will be liable for. Urgent care is the diagnosis and treatment for an illness, injury, condition serious enough that you would seek medical care right away, but not so severe that you need an emergency room visit. Urgent care centers are found in many neighborhoods and can refer you to the nearest ER if unable to provide the level of care your emergency situation demands. Utilization management can be the RNs, case managers, or medical directors that issue authorizations, determine medical necessity, organize hospital discharges, and review treatment plans. It is the people who will decide whether you will get that treatment or procedure or not. Vision is a care relating to the eyes, such as eye exams, contacts, glasses. They are usually provided by a separate policy and excluded from your medical coverage, except vision screenings for children for lazy eyes or crossed eye are considered preventive care under your medical policy. The terms of policy will determine if treatment is covered as well. I do recommend that you watch Part A of this health insurance glossary, A through K. I'll put the link in the description below. And again, thank you so much for your comments, likes, and subscribes. This is what helps this channel grow and reach out to many more patients. So thank you.